Hello, this is Chris from the Obstacle Doc, and today we are going to look at a very specific motion of the neck. It's referred to as cervical retraction and protraction. We're going to emphasize more of the retraction motion here. The clinical implication to cervical retraction is an implication of potentially stiffness, as well as utilizing it as a centralization mechanism for symptoms that might radiate away from the neck into the shoulder blade region or down the arm as well. Now again, disclaimer, we can't see inside the neck, so we can make guesstimations based on clinical presentation what might be causing these radiations. But what we can do is we can utilize repeated movements, for example, cervical retraction, in situations where patients do have radiation patterns to see if it can, what they call, centralize or approximate or pull those symptoms back towards midline, which in this situation would be the neck. If that occurs, that's a utilization of a movement that's positive for the client, as it can ultimately get rid of that referring pattern. So when we look at cervical retraction, what we want to look at is the following: keeping the chin level. What we're going to do is protraction first, where the chin is going to go straight ahead. Then as Daniela comes back, we're going to keep going, kind of creating that double chin, where the head is trying to go back over the shoulder line and possibly a little further back, and then relaxing and repeating. So cervical protraction is forward, retraction is backwards. It is not a chin tuck, it is not a nod. Those two tend to get confused. It is more of, again, almost like a shearing motion of where the head is going straight back on the neck. When this happens, you develop motion throughout the neck, but specifically in the lower third of the cervical thoracic junction. This is that union point where our neck hits our upper back in our thoracic region. It's a kind of a bony bump, rounded area in individuals. This is an area that can get stiff. When it gets tight, it is hard to retract. It's almost like you're running into a wall. So from an intervention standpoint, we can actually use cervical retractions to actually try to loosen up this infrastructure. So for clients who have difficulty, let's say, or stiffness when they look up, and it's kind of manifesting in that junction point, we can have them try retractions repeatedly, not past pain, but up into stiffness. And by doing that over time, it's almost like moving a rusty door hinge. Does that loosen up that area? And if it does, and now they can move more freely and holistically through the neck, including the upper, mid, and the lower, we've now eased up tension in that cervical thoracic junction. And again, lastly, for radiation issues, if there's any referral that can come out of the neck into the shoulder blade region or down the arm into the hand and fingers, again, without knowing what the tissue etiology may be, we can use repeated retractions to see if that centralizes or pulls that referred pattern back out of those areas and manifesting focally back into the neck. If that does occur in the right situation for that client, we would want to utilize this effectively throughout their day to try to keep that at bay and to thwart that symptom from occurring.